So today I'm going to talk a little bit about my story. So I hesitated to want to start this video diary, but I think it's important. I've been through a lot of medical things up to this point, and I really think it'd be a good idea to use this medium as a way to kind of talk about it. I won't go into, of course, my whole medical history, but I'll kind of start from October of 2020. I previously had some heart issues, shortness of breath, chest pain, activity intolerance dating back to 2012, actually like 2009. In 2012, I had an open heart surgery procedure where they did some mechanical manipulation of my heart and removed a subaortic membrane, which is a membrane that grows underneath the aortic valve that was causing increased pressure in my heart. At that time, I was told that everything was fixed. I didn't have a problem at all. Originally, they had thought I had hypertrophic cardiomyopathy, but at that point, they said I did not. So fast forwarding now to October 2020, I started to, prior to that, have those symptoms again. Chest pain, shortness of breath, racing heart, feeling faint, all of these things. And I had been in contact with my cardiologist, who wasn't as receptive as I would have liked, but finally pushed for some testing. And as it turns out, there was increased pressure in my left ventricle again, and some issues with my valves. So they ordered more testing, and then finally, with the result of that testing, sent me to a hypertrophic cardiomyopathy specialist. I saw this specialist and at a major organization, healthcare system that is a center of excellence for hypertrophic cardiomyopathy. I saw her, and she did confirm that I do have hypertrophic cardiomyopathy, obstructive kind. So I have a few obstructive things that are going on with my heart. There is a thickening of the wall of the left ventricle. My mitral valve is leaking, and it's also one of the leaflets of it is causing an obstruction, and they think that the subaortic membrane is back. So in October of 2020, I started on Norpace 3 times a day, along with a beta blocker that I take to help with the symptoms, which I religiously took. I can only honestly say that I only missed 1 dose of medication in that whole time. And so saw follow-up in January from the HCM physician cardiologist. Everything was going well. Follow-up again was July 30th. Prior to that, around July 18th or 19th, I started to have extreme chest pain, very short of breath, pain when I took a deep breath, feeling extremely fatigued. I went to the emergency room, and it turned out that I had myopericarditis. So there was an inflammation in the heart muscle and inflammation in the sac around the heart. I was told that it doesn't really have anything to do with the hypertrophic cardiomyopathy, but it does not help the symptoms. So more medication, anti-inflammatory medications for 3 months, and then follow up with the cardiologist again. I did see the cardiologist on the 30th. It was a, really unfortunate situation that I had to get that diagnosis, as well as all the other cardiac things that are going on. But really can't make a lot of decisions about my care while I have an acute process going on. So basically, I have to continue with the medication, try to lose weight, try to start exercising, and increasing my endurance the best I can. And in 3 months, the plan will be to do TEE, which is a picture of the heart where they go down your esophagus to your stomach and get some pictures of the heart to see if I have a subaortic membrane and take a look at what's going on in there. From that point, the decision will be made to either do a couple of less invasive procedures where they can clip back the part of the mitral valve that's causing an obstruction, and they can do what's called an alcohol ablation, which helps to decrease the muscle in the heart that's overgrown in the left ventricle, and that all will help with the symptoms that I have, because there is no diagnosis, there is no cure for hypertrophic cardiomyopathy. When they do that, like I said, I should have relief of symptoms. The caveat here is when they do the TEE, if they find that I have a subaortic membrane, which is, again, that membrane that grows underneath the valve, aortic valve, if that's still there, then I can't do the other less invasive procedures. I have to have open heart surgery again to remove that valve, remove that membrane. They can fix the valve. They can take some of the muscle off of the left ventricle to relieve the symptoms. So right now I'm working day to day on, trying to increase my endurance, taking my medication to help with the inflammation around my heart, continuing to work from home every day, which is a blessing, and to kind of get myself prepared for what might happen in October again. So that is the plan at this point, and I will just be working towards the goal of what I can do to keep myself in the best shape that I can and recover from my current situation and kind of